That is disgusting behavior. It's disgusting. I've been a nurse for 16 years. I've done high-risk labor and postpartum for most of my career, and that's unexcusable.
My ass! You have 2 babies at home?
By the way, those sounds she was making, that's called bearing down. That's pushing. That is not common knowledge, but you do not have to be a labor and delivery nurse to see that she's in distress. She wants help. All the while, the nurse is ignoring her, not believing her, acting as though she's being extra or dramatic. And for any of you that are even tempted to think, well, maybe the nurse was having a bad day, maybe it was really, really busy, stop you right there, because in no world are we defending that behavior. It's unacceptable, hard stop, but it's out there. This right here, ignoring, disbelieving patients, is part of the reason why Black women in America are 3 times more likely to die in childbirth than their white counterparts. Yet we wonder why people turn to social media for their education or choose home birth. We wonder why people come to the hospital with long birth plans and lots of family members and friends, because a lot of people do not trust medical professionals. And I mean, this is a big reason why. This is the exact opposite behavior of what you would expect from a medical professional. Our job is to help patients, keep them safe, advocate for them. If I'm your nurse, I want to minimize, prevent birth trauma as much as humanly possible, because I don't just believe in healthy mom, healthy baby, lowest bar. I believe in minimizing trauma even when things are critical. The fact is that that's not how everybody practices. And I want to change that. So fellow birth workers, if you see this behavior, you're going to shut it down and you're going to go and report it. Then we're going to acknowledge that is a reality for a lot of our patients. We're going to validate that. We are also not going to judge our patients when they are looking at their options. We are not going to take it personally when they're asking us a lot of questions or requesting more information, or they need a minute to think about the next steps. We're going to encourage questioning attitudes, giving them the risks, the benefits, the alternatives to any interventions or procedures. Encourage that they ask the risks, benefits, alternatives to procedures. We're going to encourage consent. We are not going to disbelieve them or ignore them. We're not going to gaslight them. We are going to help them, because even if that woman was 1 centimeter and she was miles away from delivery, she's still distressed. She still should be taken into a room and helped. That is our job, is to help her, keep her safe, advocate for her, minimize trauma. The good news is there are a lot of really, really good ones out there. I see them, I know them, I love them, I practice with them. They're out there. And we're just gonna keep fighting the good fight, and we're gonna keep turning the tides and advocating for better women's health in general. And for anyone who has experienced any version of that, if that has been your reality in any way, I'm so, so sorry. It's disgusting. It shouldn't have happened. You deserved so much